So what is Patients First? Well, we are the Royal Surrey's major transformation programme, and we've been in existence since May 2008. Initially started as a good idea. Wouldn't it be great to see if healthcare could adopt service improvement and really just give it a go and see if it brought benefits? Obviously, proving that that was a great success, we were asked to take in a number of safety and quality projects, particularly focusing on fractured neck of femur and looking at reducing emergency lengths of stay as well. Again, proved great success with those. We were governing around 35 projects in around about 2011, all across the Trust. And at that point, we'd introduced our C3I programme, which I'll tell you a little bit more about. And we had 200 yellow belts and about 21 green belts trained across the organisation in Dakota, which is our methodology, lean principles and change management techniques. And last year, we were actually supporting business units to deliver 5.5 million through supporting them in projects that they were running and also giving them direct Patients First support. But we really moved from delivering small discrete projects in areas to having a whole systems focus, looking at whole patient pathways and working with people outside of our own boundaries, so community services, mental health providers. And this year we're actually looking at returning an investment of £6.50 for every pound invested in the programme. We realised quite quickly in the early days of the programme that it wasn't really about having a team that parachuted in and said, "You're not doing that quite right, why don't you do this, isn't it fantastic?" But actually we needed to transfer the skills and knowledge to staff at all levels across the Trust so that as soon as they saw a problem, they knew exactly how to tackle it in quite a structured way. So the Royal Surrey Way, our methodology, we have a methodology called Dakota, which is made up of best practice from Lean, best practice from Six Sigma and best practice project management. It is a 6-step process, as you can see: define, establish, create, organise, do and evaluate and refine. We wanted to have something, a framework that everyone in the Trust understood, that people could really engage with. And we are very proud of the fact that we'll now get stopped in the corridor and get told, we need to decode this problem, so people recognise that it's a good framework to work through to solve any issues that they're coming across. We are sharing Patients First within the NHS, so we were very lucky to be invited up to the Department of Health to present to Jim Easton on Dakota and Patients First and the work that we're doing at the Royal Surrey. So we're great believers that if you improve quality and you improve safety, then savings will fall out of that. But always underpinning with sharing best practice and learning from others. Okay, thank you.